Today's webinar is the third in a series on HIV-related stigma, hosted by the International AIDS Society and the People Living with HIV Stigma Index partnership. You know, this is a very important topic, of course, when we can all agree on that. Stigma will negatively affect the health and well-being of people living with HIV by discouraging them from learning their HIV status, accessing treatment, or even staying in care, and will also affect those at risk of HIV, whereas those populations are those who are disproportionately affected by HIV. So in this series of webinars, the first webinar took place in June and focused on the importance of evidence-based advocacy programs, and panelists discussed the strategies and best practices for advocating for interventions to eliminate HIV-related stigma and discrimination. The second webinar took place in July and focused on the power of language in the HIV response and the importance of addressing internalized stigma experienced by people living with HIV. Today, we will be discussing drawing on data to promote human rights and reduce stigma and discrimination. And the final webinar will take place in October, so don't miss it, and will focus on reducing stigma and discrimination healthcare. So now, before starting, some housekeeping rules. We will not be taking questions from the chat. If you have any questions for the speakers, please write them in the Q&A box. Just to remind you, this webinar is available in French, English, and Arabic. To choose your language, select your language channel at the bottom of your screen. Donc, ce webinaire est aussi disponible, la traduction est disponible en français. Et en bas de votre écran, vous avez une petite icône qui vous permet de choisir le français. فقط للتذكير خلال هذه الندوة ستكون الترجمة باللغة العربية متاحة. فلاختيار اللغة العربية يجب أن تختار قناة اللغة العربية في الجزء السفلي من الشاشة. And also, please note that this webinar is recorded and will be available in the IAS Plus learning platform. So now, without further ado, I am very pleased to introduce our first speaker, Serge Tamundele. Serge Tamundele is an expert in human rights, HIV, and public health. He is currently a specialist. He's currently a specialist consultant in key populations and human rights in the UNDP health program. Previously, he was an actor in the implementation of gender and human rights program in the Democratic Republic of Congo, DRC, and in particular in a hub approach that he is going to explain to us. Subsequently, he supported the Breaking Down Barriers initiative of the Global Fund in the DRC. So Serge, the floor is yours.
Thank you. Allow me first to share some information regarding the implementation of the Genre et Droits Humains program or the Gender and Human Rights program that has been implemented in DRC. As we know, Breaking Barriers is an innovative initiative by the Global Funds where we take into consideration questions related to human rights and gender with the objective of breaking the barriers that impede the access of people living with HIV to services and care. So this initiative aimed at breaking the barriers and overcoming the obstacles that negatively affect the key populations. So, and the aim was to overcome all kinds of obstacles, whether they were cultural, political, or of any other dimension. And these obstacles could be mastered by the implementation of programs that are evidence-based and based on surveys, for example, that give concrete data about stigma and discrimination, and that could, of course, further impede access to services. Next slide, please. So just a reminder, a little while ago, the Global Fund has set this pillar at the heart of its intervention. And already since 2014, it identified 5 minimum standards of respect towards human rights, which were included in the grant agreements. And in 2016, human rights become a priority within the strategic planning of the Global Fund. In 2017, the Global Fund launches the initiative of breaking barriers in 20 countries with a budget of $45 million and set up the team working on human rights. In 2022, human rights become clear objectives of the Global Fund strategy for 2023 and 2020 until 2028. In 2022, human rights become also programmatic requirements for all HIV, TB-related grants that would be implemented between 2023 and 2025. And in 2023, the initiative of breaking the barriers extended to 24 countries after it had started, or after it was initiated in 20 countries that received Global Fund money. So here we're talking about evidence-based study and data. As I have already said, at the beginning, 20 countries were initially selected to benefit from the grant, the Global Fund grant, and in 2017, the initiative was launched. And of course, after the identification of the 5 minimum standards, the objective was to optimize equality and promote equality and human rights in the access to and use of services. As we all know, the obstacles remain numerous, and hence we had to optimize equity and equality with regards to access to health and gender equality and human rights. And a new approach was adopted, the hub approach, and this approach saw the implementation of all of these elements related to human rights and gender equality. It included the training of care personnel as well as service providers within community centers. It also included legal awareness of key population, people living with HIV, by their peers. It also included legal and judicial services by some judicial clinic. services of accompanying by the police. And of course, we had a very positive feedback regarding the impact of this program. Next slide, please. Next slide, please. So what is the hub approach that has been implemented? So we had clearly understood that we needed an integrated and holistic approach that would be contextualized, that would allow the different actors to work in synergy, and where all beneficiaries and all people living with HIV would know where to locate the services and how to access these services. So the aim is to concentrate all the services within the same town that would become the hub. And hence, service provision would become more complete, more comprehensive, and would be human rights based. And this approach has significantly reduced discrimination and HIV-related stigma and discrimination. As I have previously mentioned, the hub, of course, include main stakeholders and components. So as you see, we have the program against HIV and tuberculosis, the Global Fund, primary recipient and sub-recipient. So all of these are main actors, in addition to health centers, community centers, where key populations would go to seek the service in a convivial way. In addition, of course, to the police that would provide support and would collaborate to promote synergy. We also have paralegal personnel and peer educators who would conduct the community work and would be in charge of the outreach and the work with their peers in order to promote awareness and literacy. So in addition to these actors, we also have legal clinics or legal offices that would be in charge of the legal follow-up of key populations. And of course, the community observatories and the community mechanisms that would be in charge of assessing the impact and the efficiency of the services provided by the hub. Next slide, please. So how did these hubs function? In DRC, we started with 6 towns. So we selected 6 towns with the highest prevalence of HIV and with the highest concentration of key populations. We chose 6 hubs or 6 towns where all of these actors were operational. And the selection, of course, followed a very specific selection criteria. We looked for the presence of the different actors that we needed to be involved in these 6 towns. Next slide, please. And what were the outcomes or the results of this approach? So you can see here in the tables that under the new Global Fund funding or programs, human rights programs were focused on sexual violence survivors, and more, or rather than on the traditional key populations and vulnerable populations. And you will see that the percentage of legal follow-up of sexual violence cases increased during the implementation period. You will also see that the data provided by the community mechanisms, the community monitoring mechanisms will show an increased impact and increased the quality of the HIV services. So, of course, we used all this data and all this evidence to also measure the progress achieved when it comes to breaking the barriers. Next slide, please. An evaluation was conducted at the end of 2023, and of course, it showed a lot of progress, as you see in this table. So there was progress with regards to legal awareness, with regards to more legal literacy, more awareness of individual rights, and more awareness with regards to access to justice. So we have registered significant progress in this regard. However, at the same time, there is still a lot to do when it comes to other pillars, such as the inclusivity of the programs, among others. Next slide, please. What are the lessons learned from this program? So in general, and to summarize the main lessons learned, we can say that the implementation of the comprehensive pack of interventions in a specific and predetermined geographic area would maximize access and use of services by the key populations and vulnerable groups. Good coordination and communication between actors is key. So working in synergy is key. Otherwise, we couldn't have achieved the outcomes of this program. And good communication and coordination allow the beneficiaries to access the services and allow them to know where the services are provided. There were some initiatives also to quantify the key populations. And one of the lessons learned also was the need to have a clear mapping of key populations and of the integrated tools. Another lesson learned was that key populations are better equipped when it comes to knowing their rights when they are educated by their peers. So a better awareness and a better education can be done by peers, or is achieved when the educators are peer educators. Next slide, please. As for the challenges that we have faced, I can summarize them as follows. We were almost exclusively focused on legal literacy of key populations and vulnerable groups, and on the access to justice, so more than other dimensions within the program interventions. We could have focused also on the harm reduction, or but our main focus was on legal literacy. We have also faced a lot of delays in the implementation because it was a new experience, and hence we took our time in the implementation. And most of the delay happened at the beginning. So when we were to establish the first 3 hubs, another difficulty we faced at the level of scaling up the programs and extending them to other towns where the same problems, were identified. Another major challenge we faced was the suspension of some contracts with SRs who were implementing some activities, especially in community-based centers. And where, of course, the involvement of community-based centers was essential in the implementation of this approach. Next slide. It was your last slide, Serge. Okay, thank you. And I'm ready to answer any questions or to give more clarifications if needed about this experience of the hub approach in the framework of the initiative to break the barriers. Thank you. Thank you, Serge.
I am sure that there are many of you that have questions or comments that they would like to share with Serge. But before that, before we come to the panel discussion and the opportunity for questions, we have a short animation, a short video to share with you. This video was produced by the people living with HIV Stigma Index and will give us some more insights into the human rights challenges faced by people living with HIV. Note that this video is in its debut screening, and it is the very first in a series of animations being produced by the people living with HIV Stigma Index.
After the devastation of World War II, we stood on the brink of a new era, one founded on the inalienable rights of every individual. The adoption of the Universal Declaration of Human Rights 75 years ago marked a monumental achievement, offering a comprehensive framework of rights and freedoms. This declaration, translated into more than 500 languages, has been signed by all 193 UN member states. But have we really been able to make it human rights for all? People living with HIV or PLHIV face heightened vulnerability to human rights violations due to widespread stigma, discrimination, and criminalization. Stigmatization often leads to social exclusion, denial of healthcare, and employment discrimination, while criminalization laws unjustly target PLHIV, deterring them from seeking testing and treatment. These factors create a hostile environment where PLHIV are subjected to rights violations such as forced testing, unauthorized disclosure of their status, and violence. To protect their rights, it's crucial to eliminate discriminatory laws, promote anti-stigma campaigns, and ensure equal access to healthcare and legal support for PLHIV. Yuda's story starkly illustrates the severe human rights violations faced by people living with HIV, especially within rigid institutions like the military. Diagnosed with HIV and disclosing his sexuality as a gay man, Yuda, a former Indonesian military officer, faced brutally consequences. The deep-seated stigma led to his dismissal and, even worse, his confinement in prison for 16 months. His personal ordeal reflects broader issues highlighted by the PLHIV Stigma Index, such as forced disclosure of HIV status, denied employment, and intersectional stigma of being a key population living with HIV. Yuda's plight went beyond professional ruin. His diagnosis and subsequent isolation in prison underscore the harsh discrimination and human rights abuse that PLHIV and key populations endure.
The Indonesia's military to understand that their current policy is unjust. I will continue to respect and protect my country even if it failed to do the same for me. But I must take actions to change this discriminatory policy and bring about a better future for HIV and everyone. Now, without military weapon but armed with knowledge about HIV/AIDS and my right, I'm fighting a new battle, a war against the stigma and discrimination that people with HIV and other marginalized groups endure.
Despite the intense personal trauma, Yuda's resolve remains unshaken. He now channels his experience into a fight for justice, working with the Indonesian Positive Network to challenge stigma, combat discrimination, and advocate for the rights and dignity of PLHIV and key populations in Indonesia. This also echoes the finding of the PLHIV Stigma Index Global Report that among those who had experienced human rights abuses during the last 12 months, 73.0% had sought redress. Most often filing a complaint, 20.1%, or contacting a community organization or network of people with HIV for support, 19.8%. His story is a powerful reminder of the urgent need for systemic change and the ongoing struggle for human rights and equality. The PLHIV Stigma Index is a global initiative dedicated to empowering and protecting the rights of people living with HIV through data-driven advocacy and policy change. Our mission is to end HIV-related human rights violations, ensuring dignity and respect for all. By supporting community organizations, promoting education, and advocating for fair policies, we work to create a more inclusive and equitable world. Your involvement matters. Support efforts to combat discrimination, remove criminalization law, and champion policies that uphold everyone's right. Together, we can build a society where every individual is treated with respect and dignity, regardless of their HIV status.
Now it is my pleasure to open the panel discussion. And Serge is now being joined by Taline Torikian and Augustin Dokla. Taline is a dedicated feminist and an ardent advocate for women's rights. She has demonstrated a strong commitment to gender equality throughout her career. In 2019, she joined the MENA Rosa team and currently serves as the project coordinator of the network. In addition to her professional role, Taline volunteers with Vivre Positif, the network of people living with HIV in Lebanon. Augustin is a psychologist active in the response to HIV and health promotion in Togo for 27 years now. He is currently the president of the network of associations of people living with HIV in Togo, RAS Togo. He has led national and international advocacy work, notably for free ARVs and HIV response financing. His dedication earned him the title of ambassador for the response to HIV/AIDS by the CNRS STI Togo. So now let's begin. I will start with the question for Taline. So Taline, could you tell us about the work that MENA Rosa has done to bring together healthcare professionals and women living with HIV in order to address the issues of stigma and discrimination in healthcare setting, and this was done in Egypt and Tunisia.
Yes, first of all, thank you very much for giving us this opportunity. First of all, thank you very much for giving us this opportunity to talk more about our activities. So, MENA Rosa is a regional network of women living with HIV in the Middle East and North Africa. We have a secretariat based in Beirut, Lebanon, and 17 focal points who are women living with HIV and community advocates in 11 countries across the region. MENA Rosa's activity revolves around three main axes: awareness raising and capacity strengthening, advocacy and networking, and studies. In 2021, we conducted a regional situation assessment on the stigma and discrimination in healthcare settings, and it was followed by 3 awareness-raising videos showcasing testimonies based on true stories and experiences of women living with HIV in healthcare settings. Based on this situation assessment, we conducted an innovative project supported by VIV Healthcare in both Egypt and Tunisia. We organized a total of 20 encounters between women living with HIV and healthcare providers. The aim of these encounters was to provide a safe space for both parties. Healthcare providers, including nurses and midwives, were able to share their apprehensions, their misconceptions, and challenges they face caring for people living with HIV, and women living with HIV who are community advocates and focal points of MENA Rosa expose the direct impact of stigma and discrimination on the health and well-being of women living with HIV. And this was the first time that such encounter was being organized in MENA region. And very rarely, women living with HIV have an opportunity to sit face-to-face and discuss on an equal level with healthcare providers. And in both countries, in Egypt and Tunisia, participants did a role play where women living with HIV and healthcare providers exchanged roles. And this enabled them to truly perceive and understand the impact of stigma and discrimination and the challenges faced by healthcare providers. Through these encounters, we were able to reach a total of 517 healthcare providers. The activity was conducted in major cities. In Tunisia, we conducted the encounters in Tunis, Sousse, Sfax, and Monastir. In Egypt, we targeted 3 major cities: Cairo, Alexandria, and Minya. Women living with HIV participating in these encounters gave a strong testimony, presenting experiences of other peers in healthcare settings. They talked about obstetricians refusing to deliver pregnant positive women. They talked about hospitals where women living with HIV had a sign on their bed stating their HIV status. Some healthcare providers stigmatize women living with HIV based on their cultural and religious background. And we know that HIV is linked with quote unquote inappropriate, immoral, and illegal behaviors. So in both countries, we had similar outcomes in regards to recommendations. All participants agreed on the importance to continue organizing informative and awareness-raising sessions to healthcare providers and medical students, providing accurate information on HIV, prevention, treatment, and care contribute to eliminate the misconceptions around HIV. And they also all agreed that awareness on stigma and discrimination should be integrated in the curriculum in medical schools. And here it is important to note that 73% of the healthcare providers in Egypt who participated in these encounters never attended any training or awareness session on stigma and discrimination. Additionally, all participants agreed on the importance of having the PEP kit, the post-exposure prophylaxis, available and accessible to medical staff. They all highlighted on the importance to have in each healthcare settings, hospitals, a focal person from the medical team, an ally who will facilitate the circulation of information and strengthen the communications between healthcare providers and patients. In addition, as we rarely talk openly about HIV in MENA countries, participants recommended to organize targeted awareness-raising campaigns. And here we all agreed to engage with religious agents and media representatives in order to sensitize them, engage them as allies to our cause, and disseminate accurate information on a larger scale. We are all aware that through this activity, we were only able to reach a relatively small number of healthcare providers in each country. So we are currently seeking future fundings to implement the same activity in other cities in Tunisia and Egypt, particularly in remote and rural areas where we witness higher incidence of stigma and discrimination. And we would also like to implement these encounters in other countries of the MENA region also. Over to you.
Thank you. Are there any particular lessons that you have learned from this program and that you would like to share with the others who would like to do something similar in their own country?
Yes, well, I would like to add that a major indicator that we used to measure the success of this activity was that long after the project's implementation, some of the healthcare providers who participated in this encounter contacted the local team to talk about the impact of the encounter on their day-to-day practice. They mentioned that while caring for people living with HIV or a woman living with HIV, they recalled the powerful words of women participants, and it pushed them to change their attitude and behavior. And here we really need to mention that this project was 100% led and implemented by the community. Starting from the design of the project, the preparation phase, the implementation, monitoring and evaluation, and this guarantee an accurate and pertinent intervention based on the actual needs of the community on the ground. And in order to allow women living with HIV and community advocates to really engage in these kinds of encounters or advocacy interventions, MENA Rosa continuously conduct awareness raising and capacity building trainings and workshops for our members.
Thank you. I'm turning now to Augustin.
Can you please explain to us what the Human Rights Observatory is and how it promoted the policies and advocacy efforts in the Togo? Thank you. I hope you can hear me well. Good morning, everyone. It is my honor to be with you and to join this webinar in order to share our experience as it relates to fighting stigma and discrimination. I am a member of the network of people living with HIV since 2001, which includes around 20 organizations across Togo. We work primarily on advocacy and the capacity building activities. Since 2013, Togo has benefited from the first study to end stigma 1.0, which allowed us to provide evidence according to which we have created the Human Rights and HIV Observatory that serves people living with HIV, key populations, MSM, drug users, sex workers, as well as current or former detainees. This is an important tool that has affected other organizations on the sub-regional level. The observatory also is considered a key and inclusive tool that provides space for dialogue. In 2021, we conducted the second study to end the stigma, which also provided us with additional evidence available in the community, in work environments, and all this data has pushed us to strengthen the synergies available in our observatory and to focus on the basics, which include more than 200 volunteers across Togo, and they are of healthcare centers, professional healthcare centers, the members of the community of people living with HIV, LSM, and the drug users as well as sex workers. They work on a voluntary basis in order to raise awareness on human rights, follow-up of victims or survivors of gender-based violence, as well as providing support in administrative processes in order to ensure that they have access to their rights within beliefs, religious communities, the professional communities. Accordingly, this observatory provides clear data to end the stigma based on the two studies that were conducted. These two studies have allowed us as well to mobilize the different partners around stigma and the discrimination, and to mobilize as well the community to fight or to advocate for the end of stigma and discrimination, especially for people living with HIV and key populations. We were able to mobilize resources from different stakeholders, especially financial resources with the Global Fund, where we work to provide the financial support to come to solutions. Accordingly, these are the data that allowed us to assess the impact of our activities and to support the work being conducted to end stigma and discrimination. We did not stop at this point. In fact, the stigma and discrimination data allowed us to convince our state to include in our national plan or national agenda 2023-2026 to include the stigma and the discrimination, since there is an all-encompassing program. We were able to include human rights, ending stigma and discrimination, and governance in the national agenda. We also asked partners and managed to convince partners to finance a 4-year plan to fight the stigma and discrimination against people living with HIV and key populations. Accordingly, the stigma and discrimination activities with GNP+, UNA, etc., were able to allow us to support 6,000 to 7,000 actions under different kinds, either in the high public area or the healthcare providers. In addition, work with the different partners, especially the Global Fund, to continue to support different activities that we are currently undertaking, which strengthens the work done by the Human Rights and HIV Observatory in everything that we do. Thank you. Oh, so you were talking about the data that you collected. Can you please let us know through which channels you collect this data, and how do they serve to support the data on people living with HIV and stigma? Thank you for your question, sir. So we were working between 2020 and 2020 One, we were collecting routine data with the different sites and communities as well as key populations. These have supported the data that we already had available and that present today. They were included in the UNAIDS report because in 2014, Togo did not have any data on stigma and discrimination. However, today, when it comes to our data, we were able to build on the activities, and this data allows us to develop defend our process, to push our partners to fund the work that we do across the territory compared with the Human Rights Observatory and the different data that is available. On an annual basis, the 1st of March, we celebrate the International Day to the fight against discrimination and the stigma, and we publish a report on the state of stigma and discrimination, which is validated by a committee formed by the UNDP, the National Human Rights Commission, UNAIDS, that also validate the different reports on the 1st of March. This report is published on the 1st of March of every year, and it is reflected in the different activities in order to mitigate the impact of stigma and discrimination by 2030. Thank you. The work that is being done to end the stigma and discrimination. So can you hear the speaker? In order to fight stigma, we need to share information in order to raise their awareness on their rights. People know what stigma is, and the work that we do in terms of follow-up is the awareness raising and the denouncement of any case of gender-based violence with our partners, where they can go directly to the police station or to courts in order to denounce human rights violations. That is the process we are following in order to raise people's awareness. May I remind you that Togo has raised the awareness of more than 200 judges, nurses, police officers within the framework of supporting the victims, and accordingly we raised the awareness of individuals. Last year, there were 6 cases. There are several cases during which we have provided the support for key populations. Yes, I wanted to also add that discrimination assessment of discrimination is very important. So it is important to understand if we are making any progress it is also important to take that into account in the interventions and the different human rights packages in the Congo. If we use or implement the whole package of our programs to support the community along with healthcare professionals and community actors, it is very important. It is important to improve policies and to raise awareness of the different stakeholders in order for them to be capable to provide high quality services. It is also important to ensure community monitoring. We need to work together in order to provide objective data that we can use to end stigma and discrimination, especially when it comes to the programs. Thank you.
Yes, I just wanted to say that when we are giving the opportunity to women to build their capacity, to participate in national dialogues, to participate in encounters with healthcare providers, to advocate for their rights and the rights of other women, when they are raising their voice and sharing experiences, this is also indirectly tackling the self-stigma that they are facing. This is really empowering them and enabling them to have a say and to make a change on their personal life, on the life of their families, their communities, and on national level also.
We have a question for Augustin. What are the collaborative synergies available between the Observatory and the Ministry of Justice? So the Ministry of Justice is highly involved among the actors that support and validate the annual document or the annual report. There are other entities and the ministries that are available in addition to different organizations that validate the annual data that we collect from the field. The Ministry of Justice and the Observatory work together with the people living with HIV network in order to build the capabilities of judges to support them and raise their awareness on the stigma and discrimination, especially as it relates to PLHIV and the HIV. We provide the support and we provide the training. The ministry sends the focal point in charge of HIV, who is also a magistrate and supports us with the different steps and processes. This person will also facilitate meeting with a judge because access to justice is often difficult and strenuous. This work and the ability to collaborate facilitate several matters, especially as it comes to working with other judges or magistrates. Thank you.
We have this question from Nigeria. Lawyers Alert in Nigeria works on issues of stigma and discrimination, and our experience shows that till date, most people living with HIV are not confident in approaching the court. We have resorted to obtaining anonymity order at the start of trials for proceedings to be in chambers and the media barred from naming people living with HIV before the courts, but just the facts. This has helped in more litigation and enforcement of rights. Is this something that we should dig deeper and upscale in litigation? Questions for all the panelists, I guess.
This is a reality that we need to take into account. We also need to include the different lawyers because they are working practically. However, in the Democratic Republic of Congo, lawyers are either activists, but they are also trained to address specific subjects. The matter of trust between a victim and a lawyer may be raised. However, we work with trained lawyers, community lawyers that work in community-based organizations. We can achieve results, especially when in some cases we had seen a real increase in the cases addressed by the lawyers. In general, there are some cases where we cannot resort to the justice system. However, there are focal points and allies who understand the importance of working on reducing stigma and discrimination and who are capable of accompanying all of these procedures. We have created this pilot committee in RDC, in the DRC, and it is presided over by a cassation judge. She accompanies several cases, and she understands the need to collaborate. So we work with the judges, magistrates, and other experts. However, this is a challenge, especially when it comes to maintaining confidence and trust.
Thank you very much, Fred. We are running out of time, and we need now to draw this webinar to a close. I would like to thank you all for attending this webinar, and I apologize for those of you who have not had a chance to ask your questions. Remember that we still have the final webinar in this series coming on the 2nd of October, so please do sign up for that, and you will have an opportunity to continue this conversation. And finally, I would like to thank our wonderful panelists for their contributions today, and all the team behind the Heart of Stigma program at the IAS. Thank you very much, and see you on the 2nd of October.